All right, folks, Dr. K here, ICU Doc. Real excited to connect this way with you. It's a new kind of style, new feature outside, enjoying this beautiful weather. I figured, why not connect in this fashion? So, welcome to the show, Prevention Over Prescription. I want to talk to you about one of the main principles of our book, The Opportunities in Healthcare. So, as many of you have heard me say, the time is now to remedy this healthcare system. I see on a regular basis the issues that are negatively impacting people's health. The lack of primary care access, long emergency wait times, long waits for surgical elective surgeries. We're a G7 country. Y'all know we have the capacity to solve this problem. And from my perspective, it doesn't take massive investment. But what is clear to me is the time is now. This is why we wrote this book, The Opportunities in Healthcare, because with all due respect to people that are saying like, oh, we need this and we need more time and all that, I'm like, bullshit. Time to hustle. Time to have some urgency. If I've learned anything from the leadership and from the entrepreneurial lens is that let's leverage urgency. People are asking for this now. We have so many people coming into the country that don't have access to care. We have our elderly population that's hitting critical mass. Boomers are going to be using healthcare system like crazy in the next few years. So let's be prepared. Let's be ahead of the curve and let's start acting now. And so one of the concepts I'm going to just talk about briefly today is the preventative health side. So you guys have heard, the book, Prevention Over Prescription, my second book. We talk about the 5 pillars. Press. What's your purpose? What's your why? R for restoration and stress management. E for eating and nutrition. S for strength and exercise. The last S for social connection. So what if we use these principles at scale? Today at the gym, I was at the gym today. I ran into my boy Joseph. Shout out Joseph, works in construction, beast of a man, awesome father. When I saw him, I went on his show, and I would say he was a good 20 pounds overweight, had his typical dad bod with the large abdomen. I'd say I'd risk at metabolic syndrome if he wasn't there already. I saw him today at the gym, and I couldn't believe what I saw. I'm like, man, you're lean as F, dog, and looking strong. He goes, you know what? I just did a couple things. I started to increase my protein, and I started to walk more. 2 simple principles, 2 simple concepts that we talk about, and it was magical seeing him because you realize we do not have to make this complicated for a lot of folks. The concept is focus on 1 or 2 high leverage points and watch the magic happen. And I could not believe what I saw in Joseph today. It was beautiful. And I've heard and seen so many stories like this where we just leverage 1 or 2 things. But imagine we do that at scale. Imagine we go into retirement communities, long-term care facilities, and say, hey, we're going to try and either optimize your nutrition, your strength, movement. Often the social connection piece is already there. Maybe it is their sleep and stress management. But let's collectively focus on a few things. Let's make sure folks at the retirement home have access to high quality protein and emphasize that protein first. And let's see how often they're going to have to leverage acute care. Let's see how often they're going to have to go into the emergency room or have those falls and put themselves at risk. I don't know this as a fact, but I have a feeling if we have programming similar to this where we start this movement, care is going to change. Outcomes are going to change. On the opposite end of the spectrum, let's do this with our youth. Let's do this with our kids, man. Are you kidding me? When our kids, we're seeing higher childhood obesity. We're seeing our kids rates that we haven't seen before, mental health issues. If we start moving our kids, getting our kids moving and eating well, emphasize on protein intake, get them exercising. They're, the beautiful thing about that is their whole trajectory in life can change, and they're amplifiers. And when they have children, they're more likely to pick up on their habits. Like I just recently read the study, high intensity exercise before school, improve learning, improve attention, improve mood. You tell me we can't find 4 minutes before class to do jumping jacks and squats as a school, as a collective? Let's do this. And that's inexpensive. I saw a study recently on meta-analysis on protein intake for our youth, how that affects their growth, their development, and so forth. And I could tell you a lot of kids are under-proteined. All right? So let's not only like at minimum put some light on this, put some color on it, just put a lens on it. Let's help increase the awareness and say, yo, man, is your kid getting enough protein? In our house, protein first rule. You got your plate full of delights. These cats better eat their meat first. Otherwise, you're not getting no ice cream. You're not getting your treats or whatever it is. I don't care what day of the week it is. Hit up the food on your plate, then you get the delights. And if there's bread or whatever on the plate, eat the protein first. I'm talking to you, Zeke. Eat that protein first, son. All right. So that's our kids. What about specific patient populations that are at risk? Respiratory illnesses like COPD, cancer patients, pre-surgery, putting in this PRESS method or preventative health lens on these patient populations, I have a feeling can move the needle. We already have some preliminary data that patients that get prehab, so get prehabilitated before our surgeries, have better outcomes. We're trying to do a study, I hope this launches, on ear, nose, and throat patients before their cancer surgery that often have a lot of weight loss and struggle to manage so many of their symptoms and get deconditioned. And so what if we really strongly intervene before their surgery? What can that look like? And of course, after their surgery, when they need to repair, when they need to heal. And in fact, I was surprised to see this, even though I shouldn't be. Like, there's ties to even when you take protein powder, when you take whey protein, pre-surgery for ortho, chemotherapy for cancer patients, they have better outcomes. So that's simple intervention to move the needle. And then even all these folks that are suffering from metabolic health. Obviously, there's, we've got so many people on GLP-1s and there's a movement towards really wanting to get healthy. But what if we put a bit of more like practical tools? Like, I'll give you a quick example. There's studies out there to say that if you take some protein shake before your meal, I think it was just before one meal, it significantly improved their body composition, reduced their blood sugar, allowed them to lose weight. Like, this is a simple step. You take your guided protein before you have your meal, you're going to eat less, but you're going to make sure you're going to get adequate enough of protein, then focus on the veggies and fiber. I can guarantee you'll start winning at something, whether it's body comp, blood sugar, metabolic health, you name it, mood. Y'all going to start winning. Simple. Keep this shit simple, and we'll start winning, I promise. And so I just finished going on Greg Brady's show, and I think this is going to sound like crazy to say this, but we're in a pivotal moment as a country. There's a lot of moving parts. And when we have something to rally behind, we're stronger. So if we're a healthier nation, take pride in how we feel and how we address mental health and how we show up, everything's going to get better. We will be more proactive in our leadership. We're going to be more proactive in how we treat each other. We're going to be more confident in how we lead. And so this to me is the future of health, y'all. This to me is what needs to happen today. Shout out to my Amazon driver. You can take that here. Thanks, boss. You too. But let's do, like, there's no reason why we couldn't do this now. There's no reason why our, our, as a nation, we say, hey, we take our health and wellness seriously. This is going to translate into better students, healthier nation, better mental health, sharper kids, and friggin' a resilient country. A resilient country that will just be that much more stronger and be that much more of an example for those to follow. I promise you. It seems superfluous and crazy, but I see it. I've seen it in our own ICU. I see our young staff. I've never seen a group that takes their health and wellness more seriously and motivated to. I see them at the gym. I see them at Altea. I see them at Good Life, talking about how they're staying healthy, and it's showing up at work. We had a rough week last week, and this might seem like a leap to folks, but man, were they sharp? Were they on top of things? Were they thinking 2 steps ahead? Were they compassionate, emotionally available, and strong, mentally and physically? And I think if we show up this way, great things happen. Great things happen, folks. All right, that's all I want to say today. Opportunities in Healthcare is out now. Check out the links below. Check out the link, or just look it up on Amazon, the Opportunities in Healthcare. Because we're not just chirping. We're going to try and be that example of how we change the boogie, because the boogie's got to change. Peace.